Hey everyone, welcome back. Today I'm joined by Carly Hickey, a former critical care nurse and the founder of ACE Planning Company. In this episode, which is part of our ongoing collaboration with the Legacy Expo, we dive into the crucial topic of advanced care planning and the importance of preparing for unexpected health crises. Carly shares her journey from the front lines of critical care to helping families navigate the complexities of healthcare planning. We discuss the gaps in the healthcare system, the emotional toll on healthcare providers, and the need to engage in proactive conversations about aging and end-of-life planning. Let's dive in. Carly, thank you so much for being here with me today.
Thank you for this lovely invitation. I really appreciate it.
Wonderful. So, first, if you can tell us a little bit more about your journey into the healthcare and planning field, and also what inspired you to start ACE Planning Company.
Well, I started my career as an ICU registered nurse. I always really loved critical care and felt that being able to provide support in this phase of life was just so validating. But soon into my career, I very quickly realized that families were very unprepared for a medical crisis. The patient is unprepared, and the family that's trying to support the patient is very unprepared. And that's kind of understandable. Um, but this can cause a lot of trauma. And I think with how young a specialty that ICU and critical care is, it was really just initiated in the 1950s. We still have a lot of learning to do and proactive measures to take. And I think advanced care planning is part of that. I also noticed that, families who did engage in these proactive conversations about if I couldn't speak for myself, what would I have wanted? They were much more confident in the direction of care and tended to cope a little bit better. Families who were not prepared had a lot of guilt, a lot of anger, a lot of maladaptive coping. There was tension and disputes between the family and the care team. And I think all of this came from that lack of preparation. It's really hard to quantify that in nursing research or healthcare research. And so this is my own professional observation. Um, but I do think that there is something about that experiential knowledge there. I also started kind of digging deeper into why aren't these conversations being had? We know we're going to die. Why isn't it required for everyone who has a home and children to have a will? Why are these things kind of up in the air and not talked about more? And digging into it, it just seemed that this was the right opportunity to start a proactive healthcare planning business like ACE.
And I really love this phrase or saying that you have on your platforms, and it's help families proactively plan for the unexpected, and the UN is in brackets. And when I first read it, I kind of chuckled at myself because it's like, yeah, it is kind of, it's not necessarily unexpected because, as you said, everyone's going to die. And at the same time, often people say, oh, I didn't know this was going to happen. Can you speak more to how this specific phrase came about and how you're using it in your marketing and your branding and everything, and how some people respond to it?
Absolutely. I think that it was kind of like my branding and the name and everything. I did put a lot of thought into these things, and I do enjoy, these little play on words and being a little bit more creative with using brackets and such. But there is a common saying in our industry that there are really only two certainties in life, which is taxes and death. And when we think about that, that's why you know, we're planning for the unexpected, which is sickness, injury, car accidents, pedestrian accidents, all of these unexpected traumas, cancers, strokes, but also what's expected, the natural progression of our lives until we meet the end of our life. And I was, inspired to do this because, there were so many patients that we admitted to the ICU that were clearly very near end of life. Perhaps they had years of organ dysfunction, congestive heart failure or lung failure, lung disorders, lung dysfunction. And then, it takes one sentinel event to, you know, um, worsen their health condition. And it's those patients that have a serious illness that we're not preparing. And I started looking into advanced care planning, and it really focused on patients with terminal illness, advanced age, or serious illness conditions that were, perhaps life limiting or near life limiting. But I thought, why are we waiting until that point to start this conversation? Advanced care planning is a process. It's a muscle that we have to exercise and work out. It's a marathon. And we can't get this all done in a day. And so I think that waiting until somebody has that advanced illness is too late. And we really start with something easy, like preparing a will. Now, I know my husband and I prepared a will because we have two children and a home, and that wasn't easy, because, you have to determine guardianship of your children, and how do you choose that, easily. But, we did it, and it's just encouraging these types of things, moving the needle forward one day ahead.
And based off of your experience working in the ICU and NICU, how would you say that these experiences actually shaped your perspective on the importance of being prepared for a health crisis? And based off of this experience, do you see any gaps within the healthcare system's current approach when it comes to navigating end of life situations?
Yeah, both are great questions. I think, to put it simply, life is so much easier when you're prepared. When you've prepared a grocery list and you go to the grocery store, it's so much shorter to get your groceries. When you've done your laundry and you're ready for your week ahead and you have the clothes that you're ready to wear, that makes life easier. And think of the times when we're really stressed and we're running out to different places and just grabbing what we can. And that just adds so much stress. And when you take something like end of life and you're not ready for it, it's already bad. And you add this grief, trying to be navigate logistics when you're grieving intensely is really, really hard. And when I meet people at fairs and senior planning events and things like that, I'll introduce my business and they'll say, "Oh, that's a really hard conversation to have," and I validate and acknowledge that, but also say it's even worse when you've just lost somebody you love. So just get it out of the way ahead of time. Um, to answer your second question, I think that over time, our healthcare system has very slowly gone from, proactive and health promoting to reactive. And this is something that I think many of my ICU nursing and physician colleagues would agree. And I think that the growth of the Canadian population without the supports of family practices and things like that are, contributing factors, which, I welcome everybody, but we have to make sure that we have hospital beds and family doctors. I would love to see family doctors assigned to somebody who comes to our country. And, nobody has to wait years and years to try to find one. And especially one that, speaks their language, if language is a barrier. And I say that because sometimes people would have family doctors, but they wouldn't access them because they couldn't communicate well. And, making sure that we're honoring and making access equitable for all Canadians is really important. So I would love to see more resources from that perspective, making sure that, we can take care of everyone. And so and I think that's where we're now more reactive. We're just trying to put out fires as they start instead of being proactive and, do things to build the health of our, national community.
I love that you mentioned reactive versus preventative care. And it was just the discussion of how making sure that even before getting to the point of a healthcare crisis, just making sure that you're taking care of yourself mentally, physically, nutritionally, in order to also prevent like having to go through that experience. And then also when you're getting there, making sure that the burden for the folks who are navigating the healthcare system, like the actual frontline workers, also aren't getting burnt out and all the other things, especially over the last like 2, 3 years of everything that's been happening. So I'm glad that you mentioned that.
Well, and it's interesting that when people are grieving, typically the first emotion of grieving is anger. And
Yeah.
who receives that anger in the ICU? It's the care providers. And, you know, my husband and I both have worked in the ICU, and we both lost loved ones in the ICU very unexpectedly. And I understand that now. And I understand kind of navigating those feelings of grief and how intensely those things can feel. And, you know, when you lose a loved one, feeling like, oh, who failed, who failed us? But giving it time and seeing, you know what, this is nothing we could have prevented. You know, this is life and nature, and it's unfair. But you know, we can't necessarily blame, it's easy to blame the healthcare system for these things. And I totally understand that. And I validate and see why that happens, but it happens a lot. And I think that even with the increasing rates of litigation from dissatisfaction, that causes a lot of moral trauma for healthcare providers as well. And really, many get, you know, disregarded, or I don't know what the correct term is, but yeah, it's tough for sure. And that adds to burnout. And then you have loss of experienced people leaving the
Yeah.
profession.
Yeah. It's a cycle. And I totally understand people wanting to answer the why, like, why did this happen? Why did this take place? Um, it's just like a cycle that keeps going. But yeah, there's ways to address it and break it, and make a new cycle come about. In some of your work, you mentioned that it's really crucial to engage adult children in these conversations and making sure that they're involved when it comes to aging, illness, and end of life planning. Why do you say that? And why do you see it as crucial? And my other question with that is, I know a lot of adults who have parents and they really don't want to have that discussion. Whenever it comes up, they're like, don't talk about it. We're not going to discuss it. Let's not. How do you handle that resistance when it comes from these folks?
Well, I guess it really started with my own experience with my mom when I was 19, and she was diagnosed with melanoma. And we weren't sure how aggressive it was. It was what they call an iceberg tumor. So it looked like a small freckle, but it was actually quite large. So my mom had an iceberg tumor, and we were waiting to determine, you know, margins and staging and things like that. But it was thought that it was much more advanced than we had realized. And in that couple-week period, I started going through, okay, what do I need to know? What questions do I need to ask? I know nothing. I'm an only child. My mom's a single parent. I had a stepdad at the time. But there were all these questions that at a very young age, I was in nursing school then, that made me wonder these things. And one of the first things was, like I said, was, does my mom have a will? And where do I find it? Who do I call? Where will I live? Um, and so that experience kind of was pivotal in that thinking. But then, you know, over the course of time, I started thinking, if we're just approaching one generation to say you need a will and you need to tell your family about what you want, it's not efficient. And really, by engaging the second generation and educating adult children, we say, you know, these are the questions to ask your parents, and to say, I really want to take care of you, mom and dad, and I want to know how you want to be taken care of, you know, if you're not able to speak for yourself, and what your wishes are. I think that those conversations really foster communication and closeness. And I think it's really important, you know, to build that closeness again. And I think that exploring these wishes is important for, you know, that family unit bonding. As well, it teaches the adult child what they need to think of for themselves, if, you know, when they need a will,
Yeah.
and educating that. It was always, until we went through our losses, I didn't know what a power of attorney was. I didn't know aside from a substitute decision maker that we work with in the ICU, I didn't know what an executor was. There was so much of these legal basics that are just kind of saved for our senior years, you know, 50s, 60s retirement planning. And, you know, if you have assets and children, you really need to be thinking about that. And the sad reality is, I saw young parents pass away unexpectedly. And, it just really forced that thought of we need to be, engaging an earlier generation. And not only that, I also focus on health promotion. So, how can you improve your longevity and aging wellness early, and so that you can live better into your, senior years?
Love that. And there's also, when it comes to these discussions, I know there's stigma. I know there's folks who don't want to talk about it. There's ideas of if you talk about it, it'll bring it about onto you and your loved ones and everything like that. Just avoid it. And the reality is it'll happen. It's going to happen at some point. How can we mitigate the challenges and the obstacles when they come about? How would you say we can work to actually destigmatize these conversations?
Well, I think firstly, there's a saying, I can't be credited with this. I heard it from another person in this industry, but they said people talk about winning the lottery all the time and it never happens. And so when you talk about your death or end of life, why don't we have the same logic about that?
I love
And
that. Sorry, I love that.
it's so true. And I think that just from a North American society perspective, just, trying to move the needle forward, one step at a time, acknowledging that, yeah, these are crappy conversations to have. They're not warm and fuzzy. They're not great. But they will prevent preventable trauma to surviving loved ones. And this will honor your legacy for not leaving, an estate in disarray or intestate if you pass away unprepared. Um, and even it extends as well to business legacy planning or business succession planning for small business owners. I think there was a statistic I read recently that something about 90% of Canada's economy is small business owners. And, I've worked in large hospitals that have C-suite executives and all these, operating procedures and, grooming for the next executives that will be coming into place. But, having a small 2, 3 person business, they don't have those same things. And so getting them to think of, hey, if you had a major accident and you were in the hospital tomorrow, who's looking after your business that work so hard to build and put your blood, sweat, and tears and, probably like half a mortgage into supporting. And how do we keep that thriving without putting all the burden on family who's grieving? Because that's often what happens. I remember, there was a patient who was in charge of payroll, and somebody said, "This is the only person who does payroll for 50 families. What am I going to do?" And we were like, "Oh, we're going to call our social worker to help." Social workers are the most amazing people in intensive care units. So little plug there. But yeah, I do think that life is so complicated with digital assets and, all of these different things that really can stress families if they're not tidied nicely.
I think I saw that same statistic, and it went into saying how, especially now that a lot of folks are going to be retiring over the next 10 to 15 years, that's also going to impact how just business operates in the country, coupled with in the next like 30 years is going to be a large influx of people having to need this type of support, end of life care. And the system is already stressed right now. It will be significantly more stressed at that time. So just bringing that up, like how do we navigate it? How do we prepare? How do we make sure that we aren't stressing the system and we know how to manage it with like our own families and loved ones? So it's important to think about those things.
Absolutely. And I think about the, state of finances that newer generations have, where we really need to make sure that people are retirement planning, and so that, a family isn't surprised with the cost of frailty and aging. There was something I read that said the last 10 years of your life tend to be the most expensive for healthcare. And, that increases as somebody ages because you need more and more support. And so one of the conversations that I have with families is, especially around funeral pre-planning, is, you know, how how do we prevent the family from being surprised with a $10,000 or $15,000 or $30,000 funeral bill? is this something that the kids will know to take it from the sale of the house? And even that comes with a lot of emotion. If it's the family home of 40 years, maybe you don't want to sell that home right away to be able to get the equity of those assets. So it's so complicating. And I think that just being able to have these conversations in advance of a crisis can help navigating that crisis. Not perfectly easy, but a little bit easier.
And part of having those conversations and like removing also that little bit of stigma, you're also part of the Legacy Expo, which is taking place later this fall. Um, and getting involved in that, I really feel like is breaking down those barriers to just having that conversation, communicating that with folks. What what made you decide to get involved with the Legacy Expo? And then if you can share a little bit about um, how does ACE Planning Company help overcome some of the challenges that families experience when preparing for a health crisis?
I was connected to the Legacy Expo by a realtor that I work with in the community, Eugenie Eckler. And she said, "Hey, I heard about this. I think you'd be great for it." And so I applied and was accepted and was so impressed by the first um, event so far. And now there's another in the fall. So I think it was such for the theme of the day, the theme of, being a legacy expo. It was just so nice to be in the presence of professionals who feel truly like we're trying to protect our community. Everyone
Yeah.
there felt like their heart was in the right place. It wasn't about, making a dollar. And that's why I really like this aspect. It's not, somebody said recently, "Oh, you left, the protection of nursing to start your own business and get into that." And it's always been very intimidating to be a founder in business because it didn't feel in alignment with my, core values as a nurse. But advanced care planning and, end of life pre-planning feels very, very right. So I encourage everyone, the public, if you're uncertain or uncomfortable, step out of your comfort zone, definitely come. You'll be so welcomed. It's just a very good way to spend the afternoon with your parents. Bring your parents and rip that Band-Aid and, move that needle forward.
And then, yeah, if you can speak a little bit to the type of work that you're doing when it comes to addressing and focusing on like the adult children, like back to that, is there a difference when speaking to them in terms of advanced planning versus preparing seniors for end of life?
I think that with, the earlier generation, I equip them with the type of connection questions that they can have with their parents and, really teaching them how to buffer that first question. If you say, "Hey, mom, where's your will?" that can like send up the defenses pretty quickly. But if you say, "Hey, mom, I've been doing a lot of thinking and I just want to make sure that if there ever comes a time that something happens or you can't speak for yourself, I really want to know how you want to be taken care of." You know, being careful of the communication and the communication that we use can really change the outcome of the response that's received. And being tender and thoughtful about um, how we place these invitations. And even, our parents are of a generation that had more drinking and smoking. And so ensuring that, perhaps they need a glass of wine to feel a little relaxed, or maybe wait until after they've had their smoke and they're, not having this big, this craving that can make them maybe a bit more irritable. All of these things can, if you time it right, can really help that conversation land. And it's not about getting an answer right away. It's about even introducing the conversation as, "This is something that's on my mind and I love you and I really want to take care of you when you're older. And at some point I'd like to talk about it." That's step one. And then, you revisit and build from there. And it certainly gets easier. The first one or two conversations is the hardest. And I know from my own personal experience, parents would say, "You're my kid. I don't want to talk about it. I don't want you to have to worry, enjoy your life. It's never going to happen." But it can happen. And, you know, I think being persistent in a thoughtful way that is not pestering or, you know, if somebody's showing clearly that this is a boundary, we don't want to violate that. But we also want to say, I love you enough to really want to know what your wishes are and honor you if you're not able to speak for yourself.
I would love to hear if you have any stories that you're able to share of just a success story of a family or a person that you were working with and just really getting them to a place of being and feeling prepared for if a crisis were to take place.
I think, you know, one story that I think of a lot is I was engaged by a family to prepare advanced care plans for two parents. One, we'll say parent A was the one with a life-limiting illness. And so the reason for that really was to prepare that individual. And because parent B was, alive and in the picture, we created an advanced care plan for that parent as well, not anticipating ever needing to use it. And within a few months of preparing that advanced care plan, there was a very sudden and unexpected death that occurred with parent B. And I often check in with my clients, and so I think I did, and just said, "Hey, how is everything going? Hope everyone's doing well." And their passing was shared at that time, and the daughter said, "I never thought I would need this for parent B, and I can't believe like we did this." And so I don't, in this field of work, I don't know if I don't want to say it's a success story in the way that, we're thinking of it as, but that sort of is my goal of, safeguarding the and hearing these wishes and, documenting these legacies so that if anything happened, then the family knows what to do. And so I guess in that case, that would be the successful outcome of advanced care planning.
Beautiful. Thank you for sharing that story. And I can imagine that, yeah, the just the shock the family felt and also the work that you did to help them feel kind of secure and prepared even for those types of situations. It was very impactful. Yeah.
It's one of the hardest things I think from being an ICU nurse is you spend time with people, you may not be with them from the time they entered the hospital to the end, but there's a piece that you're with them. And at least for me, if I was, with a family from the time that we had initiated end of life care or palliative care to, after death care and watching the family leave, I always wondered, who are they going home to? What supports do they have? What are their next steps? Are they supported? And it just felt so, it weighed so heavily on me for them to leave the ICU and, have to navigate this really, really challenging phase of life in the dark. And part of Ace Planning Company, was intended to be that lighthouse after the fact to say, if you need something, we're here, give me a call. I knew your mom and dad or, your brother, whoever it was. And I, want to be a support there for you. So there's and just even I often will email clients just to say, hey, I hope everything's going okay. Just checking in, not a sales call, not a sales pitch, just, I know that, you had a rough time and hope everything's going well. And just adding in that human character that I feel can be so removed in business.
Very human centric. Human centric.
So important. Yeah.
When it comes to your future goals and the impact that you want to have, you kind of touched on it a little bit. What are you hoping that you accomplish through this venture, and just how families approach and handle healthcare crises? Like, what are your goals for the future?
My hope is just to, support, people being educated about what they need for comprehensive life planning. and to secure their future and protect their legacy and, really protect their monetary assets. It's so much more expensive to die without a will than not having a will. And people always, that's often a barrier to access. Oh, it's so expensive. Oh, it's so time consuming. But that it can save your estate a lot of money for the beneficiaries if that's important. So I'd say, getting that education out there to a younger generation and just saying, yep, it sucks. Let's just do it and protect yourself. My goal is to really warm up this conversation and be more in your face about is, are we over medicalizing death? You know,
Mm.
and I think that when you have life support that's so available in a country that provides, universal health care, it's easy to say yes to everything. But I think that, there's a lot of trauma and pain and suffering that we do to that person when we don't recognize we're at the end of this person's life and we need to make them comfortable. And I think, I'm sure every ICU nurse in this country has a story that has stayed with them to say, I think I did harm here. I think we did the wrong thing and, we didn't make somebody comfortable when we should have. I know that every ICU nurse in this country has a story like that. And, I think that by facilitating the conversations of wishes and advance directives ahead of a crisis gives families permission to accept or direct care that's in alignment with those wishes. And forgive me, I can't remember the specific law that states um, or the verbatim of the language, but essentially there is a law that says you must act in alignment with the last known wishes of the patient.
Mm.
And, I only learned that in working in ICU that it is, essentially a legal requirement to know the wishes of that person. And so really trying to bring awareness to the importance of knowing those wishes is my ultimate goal and giving peace of mind to families in such a devastating time.
It's a whole other conversation, and you're touching on like the need for mental health supports and wellness for frontline workers, doctors, nurses in the space, because it's not just a job where you go and then you leave and you're not going to be thinking about it. You're going to be thinking about, you could have done this differently, you could have done that differently, or XYZ. So you're just touching on like a much needed conversation around the wellness of the people providing health and wellness to a lot of people, um, which is a whole other discussion that I would love to talk with you at some point in the future. Um, if you could, if you had a magic wand and you could wave it, what would you say is your hope when it comes to changing policies and also like on a societal level of how we navigate these conversations with families? What would you like to see changed?
Well, I have to say, I'm already, hopeful that there's this, progression where the College of Physicians and Surgeons of Ontario have already amended their decision-making at end of life policy to include advanced care planning. I'm really happy that that's, expectation of standard of care amongst the physician community. And the physicians are our healthcare leaders. And so that's a step in the right foot forward. The a step in the right direction, I should say. I think that there's a slow emergence of advanced care planning clinics that I would love to see happen more. When a patient comes into the hospital, usually we have a goals of care discussion right away or some type of documentation to say, if anything were to happen with you in hospital, what would we do? So we already have some of that in place, but I even think that, when somebody is an inpatient in a hospital, they're already stressed. They're probably in pain. There's something going on. This is not the conversation to have them start exploring their value system or their life principles of how they wish to live. We really have to pull that back into, a space where somebody's in decent health. And so I'd love to see these conversations happen, much earlier in that lifespan. Even there's a lot of talk around menopause and education at midlife. And, focusing that education in that midlife space, I think would be a huge, huge benefit. I also think that, if we teach people how to accept this conversation and, navigate it, that sets the next generation up. So this could have, many generational impacts that can slowly weave that fabric of change that I'm so hopeful to see.
The menopause conversation is huge and so under discussed, and every so many people are going to be going through it, and it's not addressed at all in so many situations that it should be. So I'm also glad that you mentioned that. For the folks who are listening who may be a little bit younger, mid 20s, early 30s, late 30s, do you have any advice for them or any words of wisdom that you want to share when it comes to kind of encouraging them to start looking into these preparations and figuring out their advanced care plan, end of life plan?
I think my first piece of advice would be, start your nest egg early. Start your financial savings as early as you can. We are living in, a culture where we're inundated with advertisements. People are spending more. It's harder to save. Inflation is high. Um, Everyone wants to travel and live their best life, but savings is really, really important. And, compounds and investment earnings and things like that can really have that snowball effect that can impact you to be able to live independently as your senior. And so I think encouraging people to start that nest egg as soon as they can, TFSA, RSP, even like I was saving $10 a month in university. And like over time, it just, added up. It's just small little, moving that needle forward just bit by bit can really pay off in major dividends. And I would also say, enjoy, like balance your health, enjoy your 20s and 30s, but also take care of your body because it gets so much harder when you're, approaching midlife to be able to undo the damage. But balance is important and, making sure that you're enjoying life too.
Undo the damage. Yes. My last question for you is, how do you want to be remembered?
I looked at that question and I think that the most important thing to me is my family. So as a loving mother and, proud wife, that would be my first and foremost. And, maybe even um, uh, advocate of the nursing profession. I wouldn't necessarily say nursing leader, but just somebody who loves being a nurse so much and a protector of the community. That's pretty much all I would like to be remembered as. But
Beautiful.
my being a mother and being a wife is number one, I'd say.
Beautiful. I love that. Carly, thank you so much for chatting with me. Is there anything that you want to share? Anything that's coming up that we should look forward to? Let us know where we can find you.
I'd love for you to join me on Instagram at Ace Planning Co, ACE Planning Co. And or if you want to keep in touch and be the first to know about product launches and events that are coming up, join my email list. And that's on my website at aceplanningco.com. I have a really exciting release that's coming out. It's my second product in September, and it's going to be going to production very soon. So I can't say too much about that, but I'm so excited. I've been thinking about it for 5 or 6 years and have been working every single night on it for 2 hours a night for the last year, and now it's going to come to fruition. So I'll definitely be dropping hints and things like that on social media. So I'd love for you to join that community.
What a cliffhanger. Fantastic.
Oh, yeah. Keep it exciting.
Beautiful. Carly, thank you so much for chatting with me today. I really appreciate your time.
Thank you so much for the opportunity.
Folks, I hope you found today's conversation with Carly informative and thought-provoking. Her experience as a critical care nurse and her dedication to helping families through ACE Planning Company really offer invaluable insights into the importance of advanced care planning. Be sure to check out the show notes for links to Carly's resources, including her upcoming product launch and social media channels. If you enjoyed this episode, please leave us a 5-star rating and follow us online. You can find us at Philotimo that's PHILOTIMOLIFE. Thanks for listening, and until next time.